If you worked for 40 years, would you think you'd be safe when you retired? Linda Washington thought so too, until she was diagnosed with cancer, and medical bills turned her life upside down. What if the same thing happened to you? Tonight in Chicago, the temperature will drop to minus 18 degrees Fahrenheit. Linda Washington, a 58-year-old retired nurse, is leaning against a heating pipe under Lower Wacker Drive, pulling her thin blanket with trembling hands. Just 8 months ago, she was sleeping in her warm bed in her 2-bedroom apartment in Lincoln Park. The contrast is so stark it feels like 2 different lifetimes. Welcome to Street Stories Homeless. I'm here to share America's most brutal truths with you. Today, I'll tell you Linda's story, because what happened to Linda could happen to you tomorrow. This isn't just another homeless story. This is a story about how America treats the people who dedicate their lives to healing others. Linda Washington grew up knowing pain intimately. Born in Mississippi in 1965, she was the daughter of sharecroppers who migrated north seeking a better life. Her family settled in Chicago's South Side, where young Linda watched her mother work double shifts as a hospital cleaner while her father labored in the steel mills. The smell of disinfectant became synonymous with hope in their household. When Linda was 12, everything changed. Her mother collapsed at work, clutching her chest as a massive heart attack stole her breath. Linda held her mother's hand in that sterile emergency room, watching helplessly as machines beeped and doctors spoke in whispers. That night, as she stared at the hospital ceiling, Linda made a promise that would define her life. I will heal people. I will make sure no one dies alone like Mama did. She kept that promise. After graduating high school with honors, Linda enrolled in nursing school at Malcolm X College. She worked nights at a diner to pay tuition, studying anatomy textbooks between serving coffee and hamburgers to late-night customers. Her classmates remember her as the one who stayed after everyone else left, practicing injections on oranges until her technique was perfect. In 1980, Linda graduated and immediately started working at Northwestern Memorial Hospital. She began in the general ward, but her compassion and skill quickly caught attention. Patients would specifically request Nurse Linda because of her gentle touch and calming presence. When someone was having a heart attack at 3 a.m, Linda's voice was often the first thing they heard. "Don't worry, honey, I'm here." And she really was there, holding hands, adjusting pillows, making sure no one faced their darkest moments alone. By 1985, Linda had moved to the pediatric oncology ward. This was where her true calling revealed itself. Working with children battling cancer required a special kind of strength, one that Linda possessed in abundance. She would spend hours after her shift ended, reading stories to kids who couldn't sleep, teaching them card games during chemo sessions, and creating elaborate treasure hunts through the hospital corridors for those strong enough to participate. Linda especially remembers Emma Martinez, a 7-year-old girl diagnosed with acute lymphoblastic leukemia in 2008. Emma's parents spoke little English, and the medical terminology frightened them. Linda learned basic Spanish just to communicate with them, spending her lunch breaks with translation apps and grammar books. When Emma's beautiful black hair began falling out from chemotherapy, Linda noticed the little girl trying to hide under blankets during rounds. That weekend, Linda went home and spent 36 hours straight knitting colorful hats. She made them in every color imaginable: bright pink with sparkles, deep purple with silver thread, sunshine yellow with tiny flowers. When she presented them to Emma on Monday morning, the little girl's face lit up like Christmas morning. Emma chose a different hat each day, strutting down the hospital hallways like a fashion model. Other children began asking for hats too, and soon Linda was running an underground knitting operation, recruiting her neighbors and church friends to help create what became known as Linda's Magic Hats. Emma's treatment lasted 2 years. Through every setback, every fever, every night of vomiting, Linda was there. She taught Emma to play chess during the long chemo sessions, and by the time Emma was 9, she could beat most of the medical residents. When Emma finally rang the bell signifying the end of treatment, she hugged Linda so tight that both of them cried. Today, Emma is 23 years old, a college graduate working as a translator at a community health center. She still writes Linda thank you letters every Christmas, and she still has every single one of those magic hats. But Linda's greatest strength, her absolute dedication to others, also became her greatest weakness. For 40 years, she worked every holiday that needed coverage. She took extra shifts when colleagues called in sick. She stayed late to comfort grieving families and arrived early to prepare for difficult cases. Her own health became an afterthought, something to deal with later when things slowed down. Except things never slowed down in pediatric oncology. Linda ignored the warning signs her body was sending. The persistent back pain that started in her late 50s, she attributed it to 4 decades of being on her feet. The fatigue that made climbing stairs difficult, just part of getting older. The occasional shortness of breath, probably needed to exercise more. She had been taking care of everyone else for so long that she had forgotten how to take care of herself. When Linda finally retired in September 2022, she felt optimistic about the future. Her pension from the hospital was modest, but sufficient, $1,800 a month. Combined with Social Security and Medicare, she thought she could live comfortably in her Lincoln Park apartment, maybe even travel a little. She had dreams of visiting Emma's family in California, of finally reading all those books she had purchased but never had time to open. Those dreams began crumbling in March 2023. The back pain that Linda had been ignoring became impossible to dismiss. It woke her up at night, sharp and insistent, radiating down her legs and making it difficult to walk. When she finally made a doctor's appointment, she told herself it was probably just arthritis. After 40 years of hospital work, a little wear and tear was expected. Dr. Patricia Holmes, Linda's primary care physician, ordered X-rays as a precaution. When the results came back, Dr. Holmes' expression immediately told Linda everything she needed to know. The images showed multiple lesions throughout Linda's spine, clear evidence of metastatic disease. Further testing revealed the devastating truth: stage 4 breast cancer that had spread aggressively to her bones. "How much time do I have?" Linda asked, her nursing background making her brutally direct. "With aggressive treatment, we're looking at potentially several years," Dr. Holmes replied carefully. "But Linda, I need to be honest with you about what this treatment will involve." What Dr. Holmes explained next would haunt Linda for months to come. The treatment protocol would require immediate chemotherapy, radiation therapy, possible surgical interventions, and a cocktail of expensive medications to manage pain and slow the cancer's progression. The oncologist estimated the total cost at $380,000 over the next 2 years. Linda's Medicare would cover approximately 60% of these costs, leaving her responsible for over $150,000. Her entire life savings amounted to $43,000. Even if she liquidated everything she owned, she would be short by more than $100,000. There must be programs to help, Linda said, still believing in the system she had served for 4 decades. Dr. Holmes looked uncomfortable. There are some assistance programs, but the waiting lists are long, and frankly, your pension puts you just over the income threshold for most of them. You make too much to qualify for full Medicaid, but not nearly enough to afford private treatment. This was Linda's introduction to the cruel mathematics of American healthcare. She had spent 40 years helping the system function, never questioning whether that same system would be there for her when she needed it most. The answer was becoming painfully clear. Linda's first mistake was trusting that things would work out. She took out a second mortgage on her apartment, using her home as collateral for a loan that would cover the initial treatment costs. "I'll figure out the rest as we go," she told herself. "The treatment will work, and I'll have time to sort out the finances." Her second mistake was pride. Linda had spent her entire career being the helper, not the one who needed help. When her church friends asked how she was doing, she smiled and said she was fine. When her former colleagues called to check in, she mentioned being tired, but nothing more. The idea of asking for financial help felt like admitting failure, like acknowledging that 40 years of service hadn't earned her the security she thought it would. As the chemotherapy began, Linda discovered that cancer treatment is designed for people who don't have to worry about money. Appointments were scheduled during business hours, assuming patients had flexible schedules or family members who could drive them. The clinic was located in an expensive part of downtown, with parking that cost $20 a day. Each treatment session lasted 4 to 6 hours, but patients were expected to arrange their own transportation home, even when they were weak and nauseated. Linda tried to maintain her independence, taking public transportation to appointments and walking the 6 blocks from the bus stop to the clinic. After her third chemo session, she collapsed on Michigan Avenue, vomiting on the sidewalk as concerned passersby called for help. A kind stranger drove her home that day, but Linda knew she couldn't keep asking the universe for small miracles. The medical bills began arriving with relentless regularity. Even with insurance, each chemo session cost Linda over $800 out of pocket. The anti-nausea medications that made treatment bearable weren't fully covered, adding another $300 monthly to her expenses. Blood tests, CT scans, doctor visits. Each item chipped away at her savings with surgical precision. By November 2023, Linda had exhausted her savings and maxed out 3 credit cards. Her monthly bills now exceeded her income by over $2,000. The second mortgage payment was 2 months behind. The bank had begun calling daily, their tone shifting from professional courtesy to barely concealed threats. Linda tried everything she could think of. She applied for medical assistance programs, only to be told she made $50 too much per month to qualify. She contacted cancer advocacy organizations, most of which offered emotional support but limited financial aid. She even looked into medical tourism, wondering if she could afford treatment in Mexico or India, but her oncologist warned that interrupting the current protocol could be fatal. The final blow came on a Tuesday morning in early December. Linda was sitting in her kitchen, trying to figure out how to pay for her next chemo session, when someone knocked on her door. 2 men in suits stood in her hallway, holding official documents. "Mrs. Washington, we're here to serve you with foreclosure papers. You have 30 days to bring your mortgage current or vacate the premises." Linda stared at the papers, the legal language blurring through her tears. 30 days. After 30 years in this apartment, where she had nursed herself through flu and celebrated every Christmas, where she had stored Emma's artwork and kept photo albums from 4 decades of hospital staff parties, she had 30 days to find somewhere else to live. That night, Linda called David Chen from the Chicago Volunteer Social Workers Association. David had left his card at the hospital, saying he helped people navigate social services. His voice was kind but realistic when Linda explained her situation. "Mrs. Washington, I can get you into a temporary shelter," David offered. "It's not ideal, but it would give you a safe place to stay while we figure out longer-term solutions." Linda's response was immediate and firm. "I've spent 40 years taking care of other people's needs. I'm not going to become someone else's burden now. I'll figure something out." David tried to explain that accepting help wasn't the same as being a burden, but Linda had already made up her mind. Her pride, which had sustained her through decades of difficult work, now became the barrier preventing her from accessing the help she desperately needed. With her last $350, Linda checked into a Motel 6 on the outskirts of downtown Chicago. The room was small and smelled of cigarettes and industrial disinfectant, but it was warm and private. She told herself it was temporary, just until the shelter situation improved or she found another solution. 1 week later, the money ran out. Linda's first night on the street was December 15th, 2023. Chicago was experiencing one of its harshest early winters in decades, with temperatures dropping well below normal and wind that cut through clothing like razor blades. Linda found herself on a bench across from the Art Institute on Michigan Avenue, clutching the thin blue blanket she had taken from Northwestern Memorial, the same type of blanket she had wrapped around thousands of patients over the years. The irony wasn't lost on her. She was now on the other side of the medical system, one of the vulnerable people she had spent her career trying to protect. The bench was metal and conducted cold directly through the blanket into her bones. Every few minutes, security guards would shine flashlights in her direction, not approaching but making it clear she was being watched. At 2 a.m, with the temperature at 12 below zero, Linda seriously considered walking into traffic. The physical pain from the cold was becoming unbearable, but the emotional pain was worse. She felt invisible, discarded, forgotten by the city she had served faithfully for 4 decades. Then she remembered Emma Martinez and those colorful hats. She remembered the 7-year-old girl who had faced cancer with more courage than most adults, who had smiled even when she was scared, who had trusted Linda to help her through the darkest period of her young life. If Emma could fight cancer at 7 years old, Linda could fight homelessness at 58. By morning, Linda couldn't feel her toes. When she tried to stand, she nearly collapsed from the combination of cold and weakness. A passing jogger noticed her distress and helped her to the nearest emergency room. Northwestern Memorial Hospital, the place where Linda had worked for 40 years. The cruel poetry of the moment wasn't lost on anyone. Linda Washington, who had comforted thousands of patients in this same emergency room, was now a patient herself, seeking help for hypothermia and homelessness. The triage nurse, a young woman named Rebecca Martinez, looked familiar, but Linda couldn't place her until she spoke. "Oh, my God, you're Nurse Linda!" Rebecca exclaimed. "You took care of my little sister Emma when she had leukemia." For the first time in months, Linda felt seen. Rebecca Martinez was Emma's older sister, now working as a nurse in the same hospital where Linda had spent her career. The recognition brought Linda to tears, not just because someone remembered her, but because it proved that her 40 years of work had meant something. Rebecca wanted to help, but hospital policies were clear. Linda could be treated for hypothermia, but they couldn't provide long-term housing assistance or cover the costs of her ongoing cancer treatment. After warming Linda up and checking her vital signs, the hospital social worker explained the limited options available: temporary shelter placement with a 6-month waiting list, or discharge back to the street with a list of resources that Linda had already exhausted. Dr. Rebecca Martinez secretly slipped Linda a $100 bill as she was being discharged. "I wish I could do more," she whispered, "but please take this and promise me you'll try to stay safe." Linda took the money and went directly to the pharmacy, not for food, but for her cancer medications. Even facing homelessness, her nursing instincts prioritized medical compliance over immediate comfort. She bought 3 days' worth of pills and spent her remaining $15 on a gas station sandwich and a cup of coffee. Living on Chicago's streets taught Linda lessons she never wanted to learn. The city's homeless population had its own geography, unwritten rules, and survival strategies. The heating pipes under Lower Wacker Drive were coveted spots during winter, but they came with territorial disputes and safety concerns. Linda quickly learned that being a woman alone made her vulnerable in ways she hadn't anticipated. Her first week on the street, Linda was robbed twice. The first time, someone stole her purse while she was sleeping, taking her identification, and the small amount of cash she had left. The second time, someone tried to take her blanket, leading to a physical altercation that left Linda with a black eye and renewed understanding of how quickly desperation could turn to violence. It was Marcus Williams who ultimately offered Linda protection. Marcus was a 45-year-old Vietnam veteran who had been living on the streets for 3 years after losing his job and apartment following a PTSD episode. When he saw Linda being harassed by other homeless individuals, he intervened. "You're that nurse from Northwestern, aren't you?" Marcus asked after the other men had moved on. Linda nodded warily. "I heard about you from people at the shelter. They say you used to take care of sick kids." Marcus showed Linda a festering wound on his lower leg, the result of an untreated cut that had become infected. Without access to proper medical care, the wound was becoming serious enough to threaten his life. Linda examined it with the expertise of 4 decades in medicine, recognizing the signs of cellulitis that could lead to sepsis if left untreated. Using supplies she begged from a nearby convenience store, hydrogen peroxide, bandages, and antibiotic ointment, Linda cleaned and dressed Marcus's wound. She showed him how to change the dressing and explained which signs would indicate the infection was worsening. In exchange, Marcus offered Linda protection and a share of his space under the lower Wacker heating pipes. "The rule out here is simple," Marcus explained. "We take care of each other because nobody else will. The system threw us away, but we don't have to throw each other away." This became Linda's introduction to the parallel society that exists in American cities, communities of discarded people who create their own support networks because the official safety net has failed them. Linda discovered teachers living in tent encampments, veterans struggling with untreated mental illness, families with children who had been priced out of housing by gentrification. What struck Linda most was the waste of human potential. She met Robert, a former aerospace engineer who now collected aluminum cans for recycling money. There was Patricia, a retired librarian who organized book exchanges using discarded volumes she found in dumpsters. Maria, a former restaurant manager, coordinated food distribution among the homeless community, making sure elderly individuals got priority for warm meals. These were skilled, educated, experienced people who had been failed by economic systems, healthcare costs, mental health services, or simple bad luck. Linda realized that the narrative of homelessness as a personal failing was not just wrong, but cruel. Most of the people she met had worked for decades, paid taxes, contributed to their communities, and followed all the rules they had been taught would guarantee security. The system that had failed Linda was failing thousands of others in similar ways. Chicago spent millions of dollars on temporary fixes, emergency services, shelter operations, cleanup efforts, while refusing to address the root causes that created homelessness in the first place. It was cheaper to manage poverty than to prevent it, even though managing poverty was ultimately more expensive and infinitely more cruel. Linda's cancer treatment became an elaborate shell game involving multiple hospital emergency rooms and creative interpretations of identification requirements. She would use different names at different hospitals, claiming to be visiting from out of state when asked for local identification. Sarah Johnson at Rush Medical Center, Mary Davis at University of Chicago Medicine, Patricia Brown at St. Joseph Hospital. The moral complexity of these deceptions troubled Linda initially. She had spent her career following rules, respecting protocols, working within systems. But those same systems had abandoned her when she needed them most. "I'm not stealing," she would tell herself. "I paid into this system for 40 years. I'm just collecting what I'm owed." Each emergency room visit was a gamble. Sometimes she would receive the chemotherapy drugs she needed to stay alive. Other times, doctors would recognize that she wasn't being honest about her identity, and she would be turned away. The inconsistency of treatment meant that her cancer was progressing faster than it would have with regular care, but Linda had no other options. The winter of 2023 to 2024 was one of the coldest Chicago had experienced in decades. The polar vortex brought temperatures below minus 20 degrees Fahrenheit, with wind chills that made outdoor survival nearly impossible. The city opened emergency warming centers, but they quickly filled beyond capacity, leaving hundreds of people outside in life-threatening conditions. Linda's health deteriorated rapidly under these conditions. The combination of chemotherapy side effects, inadequate nutrition, and extreme cold was more than her body could handle. She developed pneumonia in January, treating it with over-the-counter medications and sheer willpower because she couldn't risk another emergency room visit so soon after her last deception. By February, Linda was spending most of her time sleeping, conserving energy, and trying to stay warm. Marcus became increasingly worried about her condition, noting that she was becoming confused and disoriented, signs that could indicate anything from medication side effects to hypothermia to cancer progression. On February 22nd, during the worst blizzard Chicago had seen in 5 years, Linda lost consciousness while huddled against the lower Wacker heating pipes. Marcus found her unresponsive and called 911, knowing that Linda might be angry with him for breaking her rule about avoiding hospitals, but knowing that she would die without immediate medical intervention. The paramedics who responded to Marcus's call were experienced professionals who had seen too many cases like Linda's. When they took her vital signs, they found a body temperature of 90 degrees, dangerously hypothermic. Her blood pressure was barely detectable, and her breathing was shallow and irregular. "How long has she been like this?" one paramedic asked Marcus as they loaded Linda into the ambulance. "I don't know," Marcus replied. "Maybe an hour?" She was talking this morning, but then she just stopped. During the ambulance ride to Rush University Medical Center, Linda's condition continued to deteriorate. The paramedics worked to slowly warm her body while monitoring her heart rhythm, which was becoming increasingly erratic. One of the EMTs, reviewing Linda's appearance and Marcus's description of her medical history, made a note in his report. "Patient appears to be a former healthcare worker, possibly a nurse based on medical knowledge demonstrated by companion." When Linda arrived at Rush Medical Center, she was met by Dr. Sarah Kim, an emergency medicine physician who had been working in Chicago hospitals for 15 years. Dr. Kim had seen hundreds of homeless patients, but something about Linda's case caught her attention. Despite her current condition, Linda had clearly once taken care of herself well. Her hands, though dirty and cold, showed the careful attention to hygiene that healthcare workers maintain. Her hair, though matted, had been recently cut with scissors rather than torn or damaged by neglect. Dr. Kim ordered aggressive warming protocols and ran blood tests to check Linda's organ function. As Linda's body temperature slowly returned to normal, Dr. Kim reviewed the paramedics' report and began asking Marcus questions about Linda's background. "She really was a nurse?" Dr. Kim asked. "For how long?" 40 years at Northwestern Memorial, Marcus replied. "Worked in pediatric cancer. Everyone in the homeless community knows about Nurse Linda. She's been taking care of people, even out there on the street." Dr. Kim was stunned. She had been working in Chicago hospitals for 15 years and had never encountered a case where a longtime healthcare worker had ended up homeless and nearly dead from exposure. She made a decision that would change Linda's life. Instead of following standard protocol for homeless patients, stabilize and discharge with resource information, Dr. Kim admitted Linda to the hospital and contacted the administration. She requested a meeting with the chief medical officer and the hospital's social services director. "We have a situation that requires immediate attention," Dr. Kim told the administrators. "The woman in bed 7 is Linda Washington. She worked as a nurse at Northwestern Memorial for 40 years, specializing in pediatric oncology. She's currently homeless and nearly died from hypothermia because she can't afford cancer treatment. The administrator's initial response was predictable: budget constraints, insurance limitations, hospital policies, all the familiar excuses for why they couldn't provide free care to someone who couldn't pay. Dr. Kim had anticipated this reaction and was ready with her counterargument. "Here's what's going to happen," Dr. Kim said calmly. "We're going to provide Linda Washington with the cancer treatment she needs, and we're going to help her find stable housing. If we don't, I'm going to contact every media outlet in Chicago and tell them that a nurse who spent 40 years caring for sick children is dying on our streets because hospitals won't treat her." The threat of negative publicity was more persuasive than appeals to compassion or professional ethics. Within 24 hours, Rush Medical Center had arranged for Linda to receive comprehensive cancer care at no cost, and the hospital's social services department was working to find her permanent housing. When Linda regained consciousness 5 days later, Dr. Kim was sitting beside her bed. Linda's first words were questions about Marcus and the other people she had been living with on the street. Even after nearly dying, her first concern was for others. "They're fine," Dr. Kim assured her. "Marcus has been calling every day to check on you. And Linda, you're going to be fine too. We're going to take care of you." Linda's story broke in the Chicago Tribune 3 days later. The headline read, "Our city's nurse was dying on the street." The article, written by investigative reporter Jennifer Walsh, detailed not just Linda's personal story, but the broader systemic failures that had led to her homelessness. The response was immediate and overwhelming. Northwestern Memorial Hospital was flooded with calls from former colleagues who had no idea Linda was struggling. Emma Martinez, now 23 and working as a medical translator, drove from California to see Linda. When she walked into Linda's hospital room, both women cried. "Aunt Linda," Emma said, using the nickname she had given Linda during her childhood cancer treatment, "you saved my life when I was 7 years old. Now, it's my turn to save yours." Emma launched a GoFundMe campaign called Save Nurse Linda. Within 2 weeks, donations had exceeded $85,000. The money was enough to pay off Linda's medical debts and provide her with stable housing. More importantly, it gave Linda something she had lost: hope. Today, Linda Washington lives in a small, one-bedroom apartment in Humboldt Park. It's not luxurious, but it's warm and safe and hers. She continues her cancer treatment, which is now fully covered through a combination of Medicare and a charitable care program established by several Chicago hospitals working together. Linda has also found a new purpose. Working with Rush Medical Center and several community organizations, she has become Chicago's first official street nurse, a healthcare provider who specifically works with the homeless population. 3 days a week, Linda walks the same streets where she once slept, providing basic medical care to people who can't access traditional healthcare services. The work is demanding and sometimes heartbreaking, but Linda has never been happier. She has found a way to use her 40 years of medical experience to help the community that saved her life. Marcus Williams has become her unofficial partner in this work, using his knowledge of street life to help Linda connect with people who might otherwise avoid medical care. Linda's transformation from homeless patient to street nurse has attracted national attention. She has been featured in medical journals, nursing publications, and healthcare policy discussions. Her story has become a case study in how systemic failures create unnecessary human suffering and how creative solutions can address complex social problems. But Linda remains focused on individual people rather than policy abstractions. She still remembers every patient she treated during her 40 years at Northwestern Memorial, and she's building the same kind of relationships with the homeless individuals she now serves. Each person has a story, a history, a set of circumstances that led them to the street. Linda's job is to see their humanity and provide whatever healing she can. Looking back on her experience, Linda acknowledges that losing her home and nearly dying on the street was the worst period of her life. But she also recognizes that those experiences gave her insights she never would have gained otherwise. She understands poverty, homelessness, and systemic inequality in ways that no textbook or training program could have taught her. The system tried to throw me away, Linda says, but I learned that real strength comes from the connections we make with each other. When the official safety net fails, we have to create our own. Linda's story continues to evolve. She is working with city officials to develop new approaches to homeless health care. She mentors young nurses who want to work with underserved populations. She maintains relationships with people she met on the street, celebrating their victories and supporting them through setbacks. Most importantly, Linda has become living proof that homelessness is not a personal failing, but a systemic problem that requires systemic solutions. Her 40 years of service to the healthcare system, combined with her 8 months of homelessness, have given her a unique perspective on how American society treats its most vulnerable citizens. If you worked for 40 years, would you think you'd be safe when you retired? Linda Washington's story demonstrates that none of us are as secure as we think we are. But it also shows that hope exists, compassion survives, and human connections can overcome even the most brutal systemic failures. The question isn't whether more people like Linda exist. They do in every American city. The question is whether we will recognize their humanity and create systems that protect rather than discard the people who dedicate their lives to serving others. Linda Washington's voice has become a voice for thousands of forgotten Americans. Her story ends with hope, but the larger story, the story of how America treats its most vulnerable citizens, is still being written. What happens next depends on all of us.